Good afternoon. My name is Greg Mazzola, and I'm the VP of Marketing at Colby-Sawyer College. And I'd like to virtually welcome all of you prospective students and families to our Tour and Explore session for you today for nursing students. Today we have the pleasure of welcoming Kevin Finn, Dean for our School of Nursing and Health Sciences. Welcome, Kevin.
Thanks, Greg.
I'd also like to welcome Joan Loftus, our Associate Professor of Nursing. Welcome, Joan.
Thanks, Greg. Nice to be here.
Great. I'd also like to acknowledge all those prospective Colby-Sawyer nursing students and their families who are participating in today's session. So glad you can all join us. Kevin, first question for you. What makes Colby-Sawyer unique compared to some other colleges, specifically for nursing?
Sure. I think there's two major factors that distinguish Colby-Sawyer from other programs in regards to their nursing programs. First off, I'd say the most important and distinguishable factor is our clinical experiences that students partake in at Dartmouth-Hitchcock Medical Center. So when students come to Colby-Sawyer to study nursing, they're guaranteed to be in clinical experiences and rotations at Dartmouth-Hitchcock Medical Center. Secondly, I would say our small student to faculty ratio and the relationships that students build with our faculty is a big distinguishing factor for our students. We have small class sizes, and the rapport that students build with the faculty is something that is unique to Colby-Sawyer nursing.
Great. Joan, anything you'd like to add?
I would just echo that I think Dartmouth-Hitchcock is really what sets us apart from other nursing programs, and our connection with them, and the fact that we do mostly about 99% of our clinicals there. It's a great place for clinicals, great experience for students.
Excellent, thank you. Joan, one of the things we hear a lot about and concerns from prospective nursing students is adjusting to Colby-Sawyer in their first year of being a full-time student. Can you talk a little bit about what that looks like?
Sure. Well, I think the college does a great job at helping students adjust to their first time away from home, first time at college, through their orientation programs and some other things they do throughout the year. But we also have the SNA, or the Student Nurses Association, that connect immediately with new nursing students and connect them with their mentorship program. So that's when we have a first year nursing student connected with an upperclassman, and they become buddies throughout their 4 years at Colby-Sawyer. And they're sort of a go-to person for the first year student to ask questions about clinical or exams or courses or faculty or just anything, any questions that they may have. So it's sort of a good connection they have with the nursing program right away.
Excellent, thank you. Kevin, can you talk a bit about academic advising? It's such an important component for the success of a nursing student.
Sure, yes, exactly, Greg. I think advising is something that students are starting right when they get to Colby-Sawyer. They're assigned a faculty advisor. And that person is really the key person that is their mentor, and an opportunity for students to have a faculty relationship right from their freshman year. And so that faculty member not only works with that student to help them choose their classes and be a sounding board for how their clinicals are going, but it's also a person that really can help them think about career planning. So after they graduate from Colby-Sawyer, their academic advisor could help them think about, well, what fields and what areas of nursing do you want to go into? So when we think about advising here at Colby-Sawyer, it's really two parts. It's the opportunity for students to have a relationship with the faculty member throughout their 4 years, to help them choose their classes, to bounce ideas off of, to have really a mentor for their time here. But also it helps them think about life after Colby-Sawyer and really advising from a career and professional perspective.
Excellent, thank you. Joan, how about creating a schedule? We know there's lots of angst and anxiety that comes, especially that first time for a nursing student to create a schedule. Can you explain a little bit what that looks like?
Sure. Well, as Kevin said, every student is given an academic advisor when they come to Colby-Sawyer, and the nursing students are assigned a nursing faculty member to be their advisor. So they meet with them at least twice a semester, oftentimes more than that. But they work on their schedule for the following semester with that advisor. And a nursing faculty member will also be working with students that are going to be coming in the fall to help them plan that schedule out as well.
Excellent. Kevin, one of the things we hear a lot about from nursing students, and we know it's a rigorous academic area, and they know it is, but we get a lot of really well-rounded students, many who want to be athletes. Can a nursing student participate in a varsity sport?
Sure, great question, Greg. Absolutely, a nursing student can be a student athlete, and I think the way we balance this is really working closely with our faculty in our nursing program, as well as with athletics, to make sure that students can do both and can be successful at both. The idea of making sure that their clinicals are on days that kind of maximize their opportunities, that least constrict their sports schedules, and understanding that academics is the priority. So being a nursing student is the focus, but at the same time, we want to make sure that students come to Colby-Sawyer and understand they can be student athletes as well. So it's certainly a time management skill that students need to develop to be able to balance both. But between the collaboration with our academic nursing program and student life and athletics, we're able to make sure that all those factors are balanced between those competing times for students.
Excellent, and balance is really the key, obviously. Joan, we just received a question from our participants, someone in the audience. Is it possible to study abroad, study away as a nursing major? And what options do you recommend?
Sure. Studying abroad in the traditional sense is challenging to nursing programs, and particularly smaller ones. Students definitely can do it if they decide they really want to do that. Oftentimes it may put somebody on a 5-year plan versus a 4-year plan. And we realize that. So a few years back, we started offering medical mission trips to the nursing students. So it gives them a piece of studying abroad, but for a much shorter period of time. So our trips took place somewhere between the December break and the restart in January. And they lasted about 7 to 10 days. So we've traveled to parts of Mexico, Costa Rica. We had some students this past year who traveled on their own and went to Ecuador. Students have gone on longer trips over the summer break and have gone to places such as Ghana. But it's been a great sort of opportunity for students to still get a bit of studying abroad, if you will, and still being able to finish the nursing program in 4 years.
Fantastic. I'm going to piggyback off that a little bit as well.
Sure.
To you, Joan, and that is the workload for nursing students.
Mm-hmm.
It's a rigorous academic program. Can you talk about the workload a bit? And more importantly, how does a student get help if they need help?
Sure. You're right. It is a rigorous program, but that doesn't say that students can't do it. Students come in from high school with different academic skills. So our first year, for the students, we offer an academic success program. And that's going to offer the students opportunities to learn about test taking and study strategies and test strategies and things like that to make them more successful. That's built right out of the nursing program, but college-wide, we also have services in place and supports in place for students to reach out to should they need it.
Excellent. Thank you, Joan.
Sure.
Kevin, the NCLEX test is such an important part of the nursing experience. Can you talk about that a little bit? And also, what is the pass rate for Colby-Sawyer students?
Sure. Yes, and NCLEX is one of the most important factors that we look at when we look at outcomes for our programs. And so when we design our curriculum and our program, we really want to make sure that students are preparing from that NCLEX exam day one during their freshman year, because that license exam will be the thing that they will need to pass in order to go on and practice So it starts right from freshman year, and it's weaved through our 4 years in all the courses that our nursing students take. In the senior year, students then prepare the NCLEX with a particular course that really gets them ready for that exam come the spring of their senior year. And so with that strategy, we've been really successful here at Colby-Sawyer with our pass rate on our NCLEX with a 99% first-time pass rate over the past 4 years, which is really outstanding. And it's an accomplishment that not only to the faculty and the students to being able to prepare and be successful on that exam.
And that's an area we're particularly proud of. Our students do extremely well. Joan, can you talk a little bit about nursing students who want to participate in a minor?
Sure.
Students come in with lots of interests, and they often ask the question about wanting to do both.
Sure. It's definitely possible for a nursing student to take a minor. Oftentimes, nursing students that do that choose minors that might augment their nursing interest. So we've had nursing students that have minored in psychology and sociology. We actually had a nursing major that had an interest in pediatrics, so she minored in child development. So it's a little bit more work. It's a few extra courses, but it's certainly possible.
That's great. That's good to hear. Kevin, can you talk about what the program looks like over a 4-year span?
Sure. Yeah. The program really it combines not only the didactic courses that students take, coming in freshman year with your science courses such as microbiology, anatomy and physiology, and then kind of jumping into your sophomore year, taking not only science courses, but now you jump into your nursing courses and your clinicals begin. And that kind of also follows to your junior year and right through your senior year preceptorship, which really gets you ready to for your NCLEX exam, as well as to kind of be a nurse once you graduate from Colby-Sawyer. So we start off with science courses and fall quickly from there. You get it right into nursing courses and the clinical experiences that accompany those courses.
Excellent, thank you. Joan, we have another question from a prospective family. Can I participate in the Western Honors Program as a nursing major?
Absolutely. Yep. We have quite a few nursing students that are Western Honors students as well. It's very similar in a way to taking on a minor. It allows the student to take courses outside of their own discipline. And it helps them to explore new ideas and ways of thinking that they then can bring back to their major and then eventually to their nursing practice. So I think it's a great idea, and it's a wonderful, wonderful program.
And Joan, continuing on the theme of the NCLEX and how important it is, and our final question today, can you talk about how we help students prepare for that all-important test?
Sure. Well, as Kevin mentioned, we start preparing students from the very start of the nursing program with their very first course. But really the focus of NCLEX prep comes in their senior year when they take a year-long course as part of the curriculum, and they practice taking tests similar to NCLEX, and they review content. And then the last 3 days of their senior spring semester, they have a 3-day live NCLEX review course on campus. So once students graduate, they are so well prepared and ready to take NCLEX that they really just do some little bit of review before they actually take the actual exam at the end of May and early June.
Excellent, thank you. Kevin and Joan, I want to thank you both for joining us here this afternoon. It was a great session. We covered a lot of ground. I'd also like to thank those prospective nursing students and their families for joining us. And we really hope that we see you at Colby-Sawyer this summer.
Great, thanks, Greg.
Thank you.
Thank you.